Pap smear is abnormal, the testing we do after that depends on your age and the result of that Pap test. So remember, Pap tests are screening tests only. They do not tell you the extent of the lesion, how much of the cervix is involved, or the severity of that abnormal test. Sometimes just a Pap for follow-up is required. Sometimes it's just HPV co-testing. Other times when the Pap test shows a higher grade lesion, a dysplasia, then other treatment or testing is recommended. These include colposcopy, cervical biopsies, endocervical biopsies, and even an endometrial biopsy. On your cervix, there are two types of cells. There are squamous cells and there are glandular cells. Squamous cells make up the majority of the outside of the cervix. Those are the ones that we can see with the microscope when we look at that. Glandular cells are the cells that make up the outside of the cervix, the opening that goes up into the cervix and into the uterus, into the endometrium. So the abnormal cells on the cervix can be classified based on those two types. So atypical cells of the squamous component show abnormalities on the outside of the cervix. These are the most common types of abnormality that we see on the cervix that an abnormal Pap will show. These are usually due to a low-grade irritation, inflammation, or even a low-grade infection, including HPV. The second type of atypical cells are the glandular cells. You can get atypical glandular cells within the cervix, the endocervix, or even the endometrium. The other types of abnormal cells on the cervix that a Pap will pick up are those squamous intraepithelial lesions. The low-grade lesions mean, again, that there is a small amount of cells that have a small amount of problem. Those are usually called mild dysplasias. The high-grade squamous intraepithelial lesions are a lot of the cells show a marked abnormality, and those are moderate to severe dysplasias. And then it's also classified as carcinoma in situ and cancer. Carcinoma in situ means that cancer has been identified, but is only confined to the cervix, the outside part of the cervix. Cancer means that those cancer cells have invaded deeper into that cervix. So when we look at Pap smears, those low-grade lesions, most of those are caused by HPV, so a lot of times those go away on their own. So those a lot of times do not require any treatment. The high-grade lesions, those don't often go away on their own, and those have more chance of becoming a cancer, so those usually require further diagnosis and treatment. The cancers in the CIS of the cervix, those do not go away. Those will require some sort of referral to a specialist at that time for further treatment. Other than using condoms to prevent the spread of HPV infection, the FDA approved a vaccine in 2006 called Gardasil. Gardasil helped prevent cancers caused by HPV types 6 and 11, which were the low-grade lesions that caused genital warts, and HPV strains 16 and 18, which were the high-risk types that cause female and male genital cancers. In 2006, this was only recommended for females, girls ages 11 to 26. So in 2011, the FDA then approved vaccination for boys of the same age. And as time has gone by, the FDA has approved a new vaccine called Gardasil 9 that included 5 more HPV strains. So that protection was against 9 HPV viral strains versus the traditional 4. And most recently, in 2018, the FDA has now recommended that women aged 27 to 45 also be vaccinated. It's key, though, that vaccinations occur prior to exposure to help prevent HPV-related infections. The Gardasil 9 has been shown over several studies to be 88% effective in decreasing cancers related to HPV of the female genital tract and reducing genital warts. Please speak with your physician at your next annual exam if you think that Gardasil 9 is important to protect you or your children.